Hello, everybody, and welcome to a brand new series called Gynecological Cancers with the Butterfly Princess and Helen Heidman. Now, within gynecological cancers, there are within this series about gynecological cancers, there are five main cancers that affect women in the gynecological area. And Helen, who will introduce herself in a minute and tell you about her journey and her work, has kindly agreed to do this mini series with me. So, in this month's episode 1, we're going to be talking about cervical cancer. Now, I must warn you that this series may contain triggering aspects, but Helen and I both feel that it's very important to talk about this and highlight the importance of getting checked, knowing the symptoms, and knowing what's out there if you have been diagnosed with any of these cancers yourself. So, hi Helen, thank you for joining me today.
Hi, Steph. It's lovely to see you, and thanks so much for inviting me. How exciting is this, doing a podcast of five different episodes?
Yeah. So, hi. I wondered, Helen, if you could tell me a bit about yourself. You know, your journey, the work that you do with regards to gynecological cancers.
Yeah, of course I will, Steph. So, my name's Helen. I'm a nurse. I've got over 30 years experience of being a nurse. And my background is in oncology, so cancer nursing and end of life, which is sometimes called palliative care. So I've worked in a variety of different roles in the NHS over the last few years. And my last NHS role was as Assistant Director of Nursing at one of the large teaching hospitals in Manchester. And then I was diagnosed with an advanced gynecological cancer myself a few years ago. And because of that cancer, it meant I couldn't go back to the job that I was doing. So I was very lucky to find a job with an amazing charity called the Eve Appeal. So I work for the Eve Appeal, and we're the UK's largest gynecological research and prevention charity. So my role in the Eve Appeal is to lead the nurse information service. So as part of that role, lots of different aspects to that role, but the main part of my role is that I manage the nurse service. So we take calls from anybody who's concerned about any aspects at all of their gynecological health. So they don't need to have a cancer. It may be that they're worried about symptoms they've got. It may be that somebody they know has been diagnosed with a cancer. It may be that they're worried about the cervical screening. It may be that they're worried about the risk of them developing cancer because they've got a family member. So that's one of the things that I do. We do lots of other things. We do a lot of outreach work. We fund research. We raise awareness of the signs and the symptoms of the 5 gynecological cancers.
So, today, in this episode, like we said, we're going to be talking about cervical cancer. So, I'm wondering, Helen, if you could give us a bit of a introduction to gynae health in relation to the cervix and cervical cancer.
Yeah, of course I will, Steph. So just to give you sort of some background information generally around gynecological health, just very briefly before we move into cervical cancer. So as you absolutely said, there's 5 gynecological cancers. So when we talk about the gynae cancers, I'm going to call them gynae cancers as we go through, because it's not as much of a mouthful as gynecological. But there's 5 gynae cancers, and many women say to us that they haven't even heard of some of these. So when we talk about gynae cancers, we're talking about cervical or cervical cancer, womb cancer, which is sometimes called cancer of the uterus, ovarian cancer, vulval cancer, and vaginal cancer. And in the UK alone, over 60 people, or around 60 people, will be diagnosed with one of these cancers every single day. 21 people will very sadly die of one of the gynae cancers every day. And across the year, we're looking at over 22,000 new diagnoses of gynecological cancers. So, as you absolutely said, in this episode, we're going to focus on cervical cancer, okay? So, within the UK, there's 3,250 women or people with cervix who are diagnosed with a cervical cancer each year. And the most common age, it can affect anybody with a cervix at any age, but the most common age that people are diagnosed is usually between the ages of 30 and 34. And so when we talk about cervical cancer, many people say to us, well, what do you mean? And where is the cervix? Where is the cervix? So the cervix is basically the neck of our womb, okay? And it connects the bottom of our womb to our vagina. And it's like the shape of a donut, okay? And the cervix is where the sample is taken from. When we go for cervical screening, which I'm going to talk more about, that's where the sample is taken from. So if you imagine, it's like there's an inside of the cervix and there's an outside of the cervix. And the outside of the cervix has skin cells and the inside of the cervix has the glandular cells. So it's that area at the bottom of our womb which connects our vagina to our womb. Okay. So as I say, it can affect anybody with a cervix at any age, but it most commonly affects women between the ages of 30 and 45 and 30 and 34. It's very, very rare under the age of 25. So in the UK, we've got an extremely successful cervical screening programme, which saves over 5,000 lives a year. So that's how effective it is. But I'm sure you know, Steph, you'll have probably heard, you might know friends, hear it all the time. People feel uncomfortable or they don't want to go for the cervical screening. And there's lots and lots of reasons for that, so many reasons. So people feel embarrassed, they're afraid, they think it might hurt. They can't always get to the GP surgery or a local place to get their cervical screening. They're not sure what it means. What does it mean and why is it important? What's going to happen when we go for this test? So lots of different reasons really why people don't go. Okay. So I'm just going to talk a little bit more about the cervical screening program, and then I'm going to talk more about the risk factors and the symptoms and how it develops. So the cervical screening program, as I say, it's a very, very successful screening program in the UK. So when you get to just before your 25th birthday, you'll receive an invitation. Now that's currently in the post, but over the next few months, that's going to become on your NHS app as well. And it will invite you to attend for a cervical screening. And when you get that letter, you make an appointment to go to your GP surgery to have that test done. Now, the reason we don't invite people before that age is because it's very common before that age, as we're developing, to have natural cell changes on our cervixes. So if we screen people too early, then it means that we're picking up non-cancerous cell changes, or abnormal cells, as we sometimes call them. And we're putting them through lots of investigations and possible invasive treatments that they don't actually need. So that's why we don't screen until that age of sort of after 24 and a half, 25. So you're invited for your cervical screening, and you go off to your GP surgery to see your practice nurse usually, and they do your cervical screening for you. And then that test goes off to the lab. So what we're looking for when you have your cervical screening. So when you have your cervical screening, the first thing that we're testing your sample for is a virus, a very, very common virus, Steph, called human papillomavirus. Okay. Now that on its own is a podcast on its own, to be perfectly honest, but just briefly, there's two different sorts of human papillomavirus, and we call it HPV. So there's a low risk strain, and that's the strain that you would get if you had maybe verrucas or warts or genital warts, and that's not associated at all with cancer. So there's no test for that. The type of HPV we test for when you go for your cervical screening is called high risk HPV. And there's 14 different strains of high risk HPV. And we call them high risk, not because if you've got it, it means you're going to develop cancer, but we know that the high-risk strains of HPV are more associated with the development of a number of different types of cancers. Okay, so those cancers are cervical, vaginal, vulval, penile, anal, sorry, and some types of mouth and throat cancer. Okay. So if you've got HPV on your cervical screening, it absolutely doesn't mean you're going to get cervical cancer. It means you've got a virus, and it's a very, very common virus, and there's very little you can do to protect against it, and it has no symptoms. It's passed on only through sexual contact. So it's passed on, that might be penetrative sex, it might be sharing sex toys, it might be touching genital skin. That's how this high-risk HPV is passed on. Okay. So there's nothing you can do to prevent it. It's very, very difficult to prevent getting HPV. And because we don't know who's got it, it's very difficult to know who's passing it on and who isn't. Now, when that shows up on your cervical screening test, the next thing that we do is we check your sample for any cell changes. Now, these are called abnormal cells or precancerous cells, but they are not cancer. And the reason that we do this test is because HPV infects the cells of the cervix, and it can cause these changes. And we want to know who's got these cell changes, so we know how often we can have a closer look at your cervix, decide what type and stage of cell changes they are, which helps us then to decide whether we can monitor you and how often we need to monitor you, or if we need to treat them to prevent them developing into cancer many years down the line. Okay. So it's what we call cervical screening is a preventative test. It's not a test that we would use to diagnose somebody if they've got symptoms. That's a very different investigation. Okay. So how does it develop? How does cervical cancer develop? Okay. As I say, the majority of cervical cancer is caused by the HPV virus. So over 90% of cervical cancer is caused by the HPV virus. So what are the risk factors? What are the things that contribute to cervical cancer? HPV, as I say, over 90% is the main cause. Cervical cancer, as I keep saying, can affect anybody at all, at any age, who's got a cervix, but it is more common in younger women. And actually, 1 in 2 people under the age of 45. So that's so half of the under 45, 1 in 2 people are under the age of 45 when they're diagnosed. People who smoke are twice as likely actually to get cervical cancer. And the reason for that is because smoking impacts the immune system, and it makes it harder for our bodies to fight the HPV virus and get rid of it. Those people who are on immunosuppressant drugs, so maybe people who were on long-term steroids or who've had an organ transplant, are at higher risk of cervical cancer because, again, they're immunosuppressed. People who sometimes had other sexually transmitted diseases like chlamydia might also be at higher risk. Okay. So what symptoms are we looking for with cervical cancer? So we're looking for anything that's not normal for you. So everybody has different types of bleeding patterns. And remember, HPV and cell changes don't have any symptoms. So cervical screening isn't going to detect the cause of these symptoms that I'm going to talk about. Okay. So the most common symptoms are vaginal bleeding that's new or different for you. Okay, so that could be bleeding during or after sex. And with cervical cancer, that's often the first sign, Steph. Bleeding in between periods that's new or different for you. Bleeding after the menopause. So we're going to talk about the menopause more as we go through this series, but the menopause is when you've not had a period for 12 months or more. So there's no sort of last period 2 years down the line or last bit of discharge. Any bleeding, any spotting, any pink discharge after the menopause always needs to be checked. And then there's other symptoms. So pain in your back or your pelvic area. So your pelvic area is that area of your tummy between your hips, and you're not expecting it, and we don't know why you've got it. Pain or discomfort during sex, and then changes to your vaginal discharge. So like changes to the smell of it or what it looks like. And, for the majority of people who have these symptoms, it's not going to be cervical cancer, but it's always important if you have some symptoms that you're not normal for you and you don't know what's causing them, it's always better to get them checked, always. So what will happen if you go for your cervical screening and you have cell changes? Okay. So if your cervical screening comes back and you've got cell changes, you will always be invited to the hospital for what we call the colposcopy. And that's an examination where we look very closely at your cervix. And that helps us to identify what type of cell changes you've got and what stage. So as I say, we can then decide, do we monitor you because a lot of cell changes go back to normal on their own, or do we need to remove them to prevent them developing into cancer in the future? Now, in terms of preventing cervical cancer, there's two key things really. So the first one is to go for your cervical screening when you're invited. And the second one is the vaccination against human papillomavirus, the HPV vaccination. Now, every child, boy and girl in year 8 is offered the HPV vaccine as part of the school's vaccination programme. And we know that the HPV vaccine has been shown to reduce the number of cervical cancers by 90%. Okay. So there's 14 different high-risk strains of HPV, and the current vaccine that's used covers 9 strains of HPV. So that's why, because it doesn't protect against all the strains, that's why even if you've been vaccinated, it's still important to go for your cervical screening. Now, other people can access the vaccine as well. So if you've missed the vaccine at school, you can have it free from your GP surgery up until the age of 25. If you are immunosuppressed, so if you're taking medication that affects your immune system, or you've got a condition that affects your immune system and you've not had the HPV vaccine, you can have it for free on the NHS up until the age of 45 from your GP or your local sexual health clinic. And if you are a man who has sex with other men, or you are if you are lesbian or bisexual, or you're at higher risk because of your sexuality, then you can, if you're transgender, for example, you are also entitled to have the vaccine for free up until the age of 45. And people often say, well, I've been diagnosed with HPV now, it's on my screening, I want the vaccine, I didn't have it at school. Great. Anybody can have the vaccine up to the age of 45. But if you're not in one of those higher risk groups, then you have to pay for it. And you can get it from larger boot stores, you can get it from sexual health clinics sometimes, and you can get it from travel clinics, but you will have to pay for it. And whilst it doesn't get rid of any strains of HPV that you've already got, it will protect you against strains of HPV that you've not yet been exposed to. So that's basically cervical screening, cervical cancer in a nutshell, Steph.
Yeah, thank you, Helen. Now that was really interesting to hear from you're obviously very knowledgeable. And I would just like to ask you, after we finish recording, if you'd be up to doing a few more series, after we've done this one on cancers, because I feel that there's a lot more things that we could explore together if you're up for doing that, of course.
Yeah, absolutely, Steph. Of course I am. Things like I was just talking about HPV. I mean, we've had a whistle-stop tour
Yeah.
today, and there's so much more we could talk about around HPV, around accessibility to screening, about how to support people, what sort of things they can do to help themselves when they go for difficult screening. So yes, absolutely, of course. Yeah, no issues at all.
Yeah, and I just wanted to chat. Obviously, we've just given a brief outline of what cervical cancer is, and I just wanted to sort of pick up on a few things because
Oh,
well, I've done a lot of work with the past of an organisation called Anti Cancer. Now, you've probably heard of that, but by doing the work that you do, and they are the leading cancer screening program within Greater Manchester. And they like raise awareness for breast, bowel, and cervical cancer screening, and they do a lot of training, and with things, have cancer champions. But a lot of the things that they say is when they talk to a lot of people, they realise that they have a lot of barriers within certain communities when it comes to screening, because certain communities, like the Asian community, for example, don't like to talk about cancer as much. So, in your work, do you find similar barriers or challenges?
yeah, absolutely, definitely. So particularly, I mean, and we'll touch more on this stuff as we go through the series, I'm sure. But yeah, absolutely, particularly with cervical screening, there are barriers to people accessing screening, and there's lots of different ones, but particularly culture is one of them, which is people don't talk about it. They find it embarrassing to talk about. There's a fear, there's that lack of understanding about what is cervical screening and how does it help me, and do I need to go. So that's a huge area. Things like people who've very sadly been, who are sexual abuse survivors or survivors of trauma or sexual violence, that can be a barrier. People who've got existing gynae conditions, and not only gynae conditions, actually, Steph, any condition, there's lots of conditions which make cervical screening hard for people. So that's a barrier. Um, Things like practical barriers, like they book the GP appointment and they go to the practice. Like I spoke to people previously who haven't been able to get, they're in a wheelchair and they haven't been able to get the wheelchair through the door, or the bed doesn't move up and down. So there's so many different barriers, and it's how we address these barriers to make sure, because everybody's entitled within that age range of 25 to 64, everybody's entitled to cervical screening. So how do we make sure that, one, people understand the importance of it and communicate the importance and raise awareness of and educate people, but not only members of the public, healthcare professionals. How do we work with healthcare professionals to support them to be able to break down the barriers that prevent people accessing cervical screening?
And it's interesting, that you mentioned some of the barriers there. You mentioned, like some people have conditions and that prevents them from attending a cervical screening test. And when you said about you spoke to a person who was a wheelchair user, I can relate to that because I have cerebral palsy. I'm a wheelchair user myself. I have attended cervical cancer screening because of that age range. I'm 32, and they haven't been able to perform a cervical screening on me because of the spasticity down below. And
Yeah.
me, I just worry that I'm missing out on things, things that should be checked on a regular basis.
Yeah, absolutely. And that's really interesting, Steph. So what we usually say, so I guess there's a couple of things there. So you, like anybody else, are entitled to have your cervical screening. And what we should be doing is to think, right, okay, it's very difficult for you to have that screening test, but we should be able to facilitate that. So for women who have similar issues, Steph, what we usually say, there's two things. What we usually say is that we ask the GP, we talk to them, and the GPs can refer them to the hospital, to actually the colposcopy clinic. Now, the colposcopy clinic is, I mentioned that before, it's where we go if we find any cell changes. It's also where women go if they've got symptoms. of cervical cancer, the GP refers them there. And then it's also the place that we refer people to if they're unable to have their cervical screening done at their GP practice for lots of reasons. And the reason we refer them to the colposcopy clinic is because the staff at the colposcopy clinics are the experts in doing those most difficult screenings and painful screenings, and they have lots of things available to them that are not available in general practice to enable you to have your cervical screening. So that's the first thing. And the second thing is, in the very near future, I don't know if you'll have seen it in the news stuff, but there's been a lot of studies done on what we call HPV self-sampling. Okay, and that's basically I think we all remember the COVID swabs.
Yeah.
And this is a test that's going to be coming out hopefully in the next. It's going through. I'm not sure when it's going to be out, but it's going through all the panels to be put into the NHS over the next year or so, and it's basically like a swab, and people will be able to swab their own vaginal area and send off that swab. And if that swab, their own vulval and vaginal area, send off that swab, and it will be checked for HPV. Now, if that test is negative, then that's the end of it. You don't need to go for a traditional cervical screening. If your test showed you've got HPV, then yes, you're going to need to go for a traditional cervical screening, as I've been explaining. But there's lots of different ways, there's different brushes, there's lots of different ways. So everybody should be able to have a cervical screening, Steph. Everybody.
Yeah, thank you. And just to finish off, Helen, mainly reason because I wanted to talk a bit about the charities, because I know that there are a number of charities, there's the Eve's Appeal that we talked about. And I think that would be a good podcast series as well, to because I'm sure there's different aspects of the work that they do, and obviously it'd be good to do a podcast series on your work as a nurse, because I'm sure that would be very interesting and informative. But I just wanted to have a quick overview really of other charities that are available to office to support people who are going through cervical cancer. Where can they go for support and help from others?
Yeah, absolutely. So and that's really important. So I don't know if you've heard of Joe's Trust, but Joe's Trust was a cervical cancer trust and very sadly closed down about 12 months ago. So the majority now of cervical cancer queries do come through to us at the Eve Appeal. We are the main charity for cervical cancer. But then, there's other, if people have been, so if people are listening and have got questions about HPV vaccination, about cervical cancer, cervical screening, then I would say please do get back, please do get in touch with us. I'm very happy to speak to anybody. If people have been diagnosed with cervical cancer or know somebody or worried about symptoms, again, those sorts of queries, the GP practices signpost to us. Now, if you've been diagnosed with cervical cancer, there's other charities available who will be also able to support. So people like Macmillan and the local Maggie centres are very, very good at offering support around gynae cancers, and also, local charities. So, we're in Bury, aren't we? So the cancer centre in Bury is also very good. And then, we tend to signpost on a very individual basis. But to be perfectly honest, Steph, aside from us, there's very little support out there. We've taken over where Joe's very sadly left off.
Right, and that's why I think that it'll be interesting and informative to do a separate, series on that with regard to it being the main cervical cancer charity. So
yeah.
I'm gonna leave it there for today, everyone. And thank you, Helen, for giving us that whistle stop tour of cervical cancer, and I'm sure that people will find it very informative. I certainly have, and I look forward to continuing this series, and it's inspired us to think of more ideas to talk about for future series, so thank you very much for that.
My absolute pleasure, Steph. It's been
Yeah.
great, and I hope it's been helpful.
Yeah, so thank you to everyone for tuning in. I hope you found this very informative. I'll turn off the recording now.